Healthcare doesn't have to be expensive. Free medical clinics help local residents in need. Learn about the Smith Medical Clinic from its executive director, coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at the Fox 43 studio. We're focused on free medical clinics, and we're visiting with Susan Surratt, the executive director of the Smith Medical Clinic in Pawleys Island. Good morning, Susan.
Good morning. Thank you for having
me. It is
me.
in Pawleys Island, isn't it?
Yes, it is.
And the Smith Medical Clinic's been around for how long now?
It was founded in 1985 by Dr. Cathcart Smith, who retired in the Murrells Inlet area, and he happened to be the first internist, or one of the first internists in the Conway area. And he started that clinic when he retired. He's ready to retire, but not ready to give up practicing.
I bet he wasn't. And of course, he continued that the growth of the Smith Medical Clinic, along with so many of the volunteers in the South Strand area, for a heck of a long time.
Absolutely.
For a heck of a long time. Real quick about yourself, Susan. Are you originally from the area?
No, I grew up in Raleigh, North Carolina. I moved to Charleston after graduating from college, and I've been in the Pawleys Island area for about 10 years.
Is that right?
Mm-hmm.
What brought you to Pawleys?
My husband's job.
Oh, good.
Yeah.
And he is where, if you don't mind sharing?
He is an Anglican priest at All Saints in Pawleys Island.
Oh, great. Boy, he's busy.
He does stay busy.
I'm sure. Of course, when folks think of free medical clinics, I guess a lot of things come to mind. What was the mission of the Smith Medical Clinic when it was set up in '85? Has it changed at all? And what is it today?
The mission is still the same. It's basically to provide health care to those who are unable to afford it, basically to the working poor, those that are uninsured or underinsured. And that really is our mission today.
Okay. Okay. So the mission in '85 is the same as it is today?
Absolutely.
And y'all's funding sources primarily?
They have changed from when the mission first started. When it first started, Dr. Cathcart probably funded it himself along with some of his buddies. They didn't have a lot of medical supplies. Our services have expanded, and we now have one full-time employee who is our front desk office manager, and then we have 7 part-time employees.
Okay.
So, of course, that will increase the budget. And with that, all of our funding either comes from grant writing or donations and fundraising.
And what are some of y'all's primary fundraising vehicles?
Well, we just have completed our annual fundraising event. This is the 5th year that we've done it. We have a black tie dinner with a limited auction. It's at a local restaurant in Pawleys Island, Frank's Outback. And all the food is donated.
Wow.
Everything is completely donated. Tickets are $150 a person, and we had a sellout, and this year we have raised over $104,000.
Oh, come on.
I'm not kidding. It's been unbelievable. And
that was back in April.
That was back in April, absolutely. And what it shows is that the community is embracing the clinic and supporting it, and that's great. We've had more community support and sponsorship this year than we've ever had before. So
that's the singular event each year, or are there other things?
Right. No, as of now, that is the only fundraising event that we have. The rest is up to grant writing and individual donations.
For viewers who may not be familiar with grant writing, how do y'all go about? Do you have a grant writer specifically, or do y'all tap volunteers for that? And who are some of the folks y'all would submit grants to?
We, when I first came in 2000, was the first time a grant was written, and they had contracted out with an individual in the area who is a certified grant writer to do the grant writing. And from then on, I do the grant writing, so I've modeled that behavior. We're in the process of trying to coordinate or contract out with someone to do some grant writing for us. It's a tedious process, just trying to search and go through the grants that are available for our area. We have gotten a grant from the Duke Endowment. We received a large grant, and we did that in conjunction with the hospital, Georgetown Memorial Hospital. And we have received a grant from the Blue Cross Blue Shield Foundation, the Susan Komen Foundation. I'm trying to think. Those are the ones that come to the top of my mind.
Right, sure. And what are some of the reasons that an endowment would support? I mean, obviously there's myriad groups that are talking to them or communicating with them, trying to receive grants for their. What was it about the Smith Medical Clinic that you think got the Duke Endowment, for instance, involved or really interested?
Part of the Duke Endowment has a vested interest in Georgetown County, and I think basically healthcare is just such at a crisis level. Every time you pick up the paper, you're reading about it. There's over probably 15% of the population, which is approximately 550,000 people in South Carolina today, are uninsured and do not have health insurance. We seem to be the state that has the epidemic illnesses, or the ones that go untreated, and the early deaths and the early complications, and that probably played a big part in it, statistics.
We've had folks from Friendship Medical Clinic in a number of times, and of course, I guess that serves also as a free medical clinic.
Absolutely. There are 25 free clinics across the state of South Carolina, and the director, Terry Harris, is part of our organization, and they service the Horry County population. We now have focused in on pretty much Georgetown County. We do have probably a third of our population are from Horry County, but that's probably just right over the line, Garden City, Surfside area.
So, of course, Smith and Friendship being two of the 25 statewide, where are some of the other ones, and what are some of the critical areas they serve?
Columbia has a large free clinic there. Kershaw County. Greenville has several, Anderson, Spartanburg. They're really distributed throughout the state, and most of them serve within the counties that they're located in.
Okay. And of course, is there a group that more or less helps tie the free medical clinics together, and are they part of any other groups?
Actually, there is. About 5 years ago, the South Carolina Hospital Association, one of the vice presidents by the name of Jim Walker, realized that there were 20-some free clinics across the state. And how could they benefit from partnershiping, or how can we get these free clinics together? And he created an umbrella organization called the South Carolina Free Medical Clinic Association. Right. And as a result of that, the organization has applied for grants. They've gotten grants. They've filtered money down to individual clinics. We have a databasing system that is just phenomenal for each clinic. They provided the computers. We partnershiped with the Office of State Research in Columbia, who developed a database program for us, and all patients are logged in, and the data is analyzed quarterly. Wow. And it's just phenomenal what you can get. You can get the percentage of diabetics that come through, the top 10 medications. You can do a breakdown on basically any data.
That's fantastic. You know, we had I believe he was a minister, maybe he was a doctor, Dr. Washington, I think, from Shared Care. Is that a group you're familiar with at all, from Horry County, a group put together to help provide, maybe it was just medicine for the or underinsured? I
do know about Shared Care just a little bit. In fact, we actually refer to them because we are no longer seeing new patients from Horry County, because they have developed that program. I always like to say it's kind of like a program, no child left behind, but no person left behind in healthcare. Right. And apparently they refer them out to providers within Horry County who have agreed to see uninsured people.
So, of course, the grants, the annual fundraiser, the big, and that's a black tie event, $150 a ticket. That's a pretty big deal. Sure, and of course, the idea of taking advantage, for folks to take advantage of a free medical clinic, I think you mentioned the gentleman was from the South Carolina Hospital Association who helped come up with the idea of teaming the 20-plus of free medical clinics together. What prompted them to be so interested in free medical clinics?
Well, I think at the time, a lot of the hospitals across the state were being hit hard with different taxes. And we look at overuse of the emergency room. In South Carolina, there's so many uninsured people that there are a lot of people that show up in the emergency room for an earache, or show up having a stroke and have never been to the doctor, and they're hypertensive, or they show up in a diabetic coma and have been diagnosed with diabetes, but yet they don't have anywhere to go to get treated. So what they're looking at basically, and we have the first 2 years of statistics to show, free clinics make a difference. And they look at the hospitals in the areas where the free clinics are located, and we can show that for certain diagnoses it has decreased. In other words, people are not using the emergency room as a primary care site, which is what was happening.
Great, good. So you all have had you've been able to reflect that dramatically.
Absolutely, and by using the database program that the organization provides for all of its members, we're able to pull those statistics and show it by numbers. So it's great, and that really helps with grant writing too.
Of course, community hospitals oftentimes are forced to serve even a different role or a greater role, because so many folks will come to the community hospitals, whether it's for prenatal issue, for pregnancy issues, as well as you say, the emergency rooms are strapped. Georgetown Memorial, Conway Medical, Loris, a lot of the community hospitals that oftentimes are dramatically strapped by folks just popping in.
Absolutely. In any given day, the waiting room is packed. A majority of them are not true emergencies.
Mm-hmm. What's a given day like for you, Susan?
Well, the clinic opens up about 9 o'clock in the morning. On the average, we're open Monday through Thursday from 9 to 12. And in that time period, we see anywhere between 20 and 30 patients. So it's pretty fast-paced.
Between 9 and noon?
9 and noon.
Wow.
So it's a limited hours. Altogether, we're probably open 14 hours a week.
Okay. I think I saw back in the late 90s y'all were serving, or was seeing a little north of 2,500 patients a year, where in just last year, north of 4,300.
Absolutely. We have just seen a dramatic increase, and I think more as the cost of insurance goes up, more and more people are unable to afford it. And the average person that uses our clinic, they're the working poor. They're the ones that are doing jobs. They're cleaning houses, they're cleaning condos, they're a chef somewhere, or waitressing tables, lawn maintenance. So they're actually working, but their income may not be able to allow them to afford to buy insurance, because insurance is very costly. So that's one of the things they sacrifice.
A very difficult thing to sacrifice at that. When we think about, obviously, the volunteer base there for the Smith Medical Clinic, of course there's a heck of a lot of retired, just like Cathcart Smith was, Dr. Smith was, a heck of a lot of retirees in the Pawleys Island or South Strand area, other parts of Georgetown. Is that your primary volunteer base as it relates to physicians? And then what are some of the other volunteer bases?
Absolutely, it really is. And we are blessed because we're different than most free clinics in the state. They use active physicians, so their hours vary. A lot of them have nighttime clinics 1 or 2 days a week based on when the physicians can be there. And with Pawleys being such a wonderful place to retire, we have a lot of retired physicians to pull from. They pretty much do the day-to-day operations. We have an evening clinic that is open from 5:30 to 7:30, and we have a handful of physicians that volunteer their time there. The ones that are practicing during the day, they come and rotate through.
Okay.
And so they help us run that clinic.
Okay, good. If a viewer needed to get off to work right now, what's a good phone number to call? Do you all have anyone there they could call to learn more if they've got to get off to work now about the Smith Medical Clinic, or do you have a website they could visit?
We do not have a website, but we do have a phone number. It is 843-237-2672, and our office manager is there from 8 to 4.
Okay, 237-2672.
Right.
Okay, great. And of course, the opportunity to learn to call in. I'm sure there's some practical information that folks could check into. How about some volunteer opportunities?
We never turn down a volunteer. We're always looking for new volunteers. Our volunteer force is really we have over 100 volunteers, and we have different jobs. We have some that are nurses, nursing assistant. They do the basic triaging and assessing of the patients. We have volunteer physicians. We have volunteer nurse practitioners, volunteer physician's assistants. We also have people that manage the front desk, which would be checking the patients in, putting the charts together. We have a pharmacy. We have people who work with distributing the medications or organizing samples. We have a whole fundraising committee. That majority of those people do not come in to the clinic to volunteer weekly, but during 4 months prior to our fundraising event, that's when their busy time is.
Sure. Is there a critical need right now of where volunteers would be most needed, or the preparation for any other potential fundraising activities other than the annual black tie event in April?
We can always use volunteers in any capacity, especially nursing. It seems like we are maxed out on our nurses right now, so we need more nurses.
Where are y'all located, Susan?
We are located on the grounds of Holy Cross Faith Memorial Episcopal Church in Pawleys Island. That's where Cathcart started it. It was in a little trailer, and then in 2000. There was a new rector came to the church, and there was an empty building. It used to be Camp Baskerville, and it was a camp cabin. And Cathcart had gotten some money from a golf tournament, and they used that money to renovate the cabin. And the church gives that to us as an in-kind donation, so they give us that building to use.
Wow.
Which is wonderful.
And the facility, you said an old camp,
It's an old camp cabin. You would never know it if you walked in. It would be as if you were going to your physician's office.
Is that right? It had been upfitted quite a bit.
Absolutely.
This has been a great golf tournament.
Yes.
She's done pretty well on that golf tournament. Of course, when you think about, I'm sure there's opportunities where either patients or families or otherwise, so oftentimes, I think I saw a piece in a local newspaper that highlighted even some patients, some folks that have been there regularly that talk about how vital the Smith Medical Clinic has been to them. And I'm sure you've got a lot of repeat not customers, but folks who've been coming there for quite a long time.
We do. Our actual patient base is we probably have about 1,600 patients, and out of that equates to over 4,300 visits each year.
So that's how you get to those numbers.
Right.
Of course, is when folks think about volunteer activities and the opportunities that they could make a difference, oftentimes folks think, oh, I can't really make a difference. I'm not a nurse or I'm not a doctor. But as you highlight some of the fundraising opportunities, and surely donations, I'm sure, are always accepted. You all serve as a 501c3.
Right, we are. We have our own tax ID.
Okay. Are there ever needs for the South Carolina Free Medical Clinic Association, and is it housed in a certain location, or is just the conduit of the 25 working together?
It is basically an umbrella organization. When we meet, we go to Columbia. There's a board of directors, and we meet at the South Carolina Hospital Association. So right now we're still an umbrella organization, but we are in the processes of doing grant writing ourselves.
Okay.
The organization is. We have 3 part-time staff members that do that for us.
What are the most prevalent diseases that you all would see on a regular basis, Susan?
Number 1 is hypertension. Number 2 is diabetes. And those are the most common throughout the state, and really at our clinic too.
Are there things that viewers can be doing to help take off, you as with a nursing background, of course we didn't talk much about your background directly, but with a nursing background, are there things that viewers can be doing to help take the pressure off, possibly even of the free medical clinic, before even thinking about going to the hospital?
Lifestyle changes. Exercise, diet, and eating right are key to any health nowadays. I mean, that will prevent lots of different diseases.
We've got about 7 minutes, Susan. Think about some of the frequently asked questions that folks, when they're thinking about Smith Medical Clinic or free medical clinics in general, things that you all hear on a regular basis. What are some of the questions that if you talk to somebody out on the street, not in the 9 to noon time period, but just someone you'd bump into, what are some of the things that folks most often think of when they hear free medical clinic?
They mostly think of, and it's kind of they're a little disillusioned because they think that these are the homeless people, the ones that are not working. A majority of our population they are the working poor. That's a big question. Who comes to your clinic? Which I've already stated, and even some of the various jobs.
Right. Of course, that's a critical aspect there. And of course, when you talked about some of the other locations throughout the state, I think you mentioned a second ago that 2 other free medical clinics have kicked off within the last 12 months.
Absolutely, Clemson and I believe it was Taylor's.
Okay, sure. And of course, are the free medical clinics different throughout different parts of the state? I think you highlighted, of course, the benefit of having a lot of medical practitioners that have retired to the Pawleys Island area. The needs within the free medical clinics, the pressure that's put on the clinics throughout the state, I assume, would be very similar. Are you familiar in dealing with, throughout the association there, free medical clinics, of some other pressures that are put on clinics in other parts of the state?
Each clinic is totally different, and it's really based on their volunteer base. And in particular, being a retired area, we're able to offer more services. We have urologist who volunteers once a month. We have an orthopedic, different surgeons that come in and do simple procedures in the office, gynecologist. And some other areas do not have that available. So that puts a burden on them. What do we do with this patient now? Who can we refer it to? And how can they get the care that they need?
Susan, growing up in the Triangle, had you contemplated early on in life that you get active in either the medical profession or even later in service, something much like this?
Actually, no, I did not. I never really thought about going to nursing school until I was in college, and I was at Meredith College, and I had to declare a major, and I had gotten closed out of all my courses. I was going in as a business major, taking a lot of sciences, and then I just decided to go into nursing. Nobody in my family was in the medical profession.
So when you think back on your childhood, there was really never any indication that you would go into medicine?
No, never played nurse, never played doctor.
Yeah. And your first job out of college was you ended up going straight into nursing after college?
Right. I moved to Charleston, South Carolina, and worked at Roper Hospital. So that's where I'm doing staff nursing. Worked on a general medical surgical floor, and then from there I went on into the critical care, emergency room and ICU and pediatric intensive care unit.
Great. You talked about the big event in April. Break down that night for viewers who may not have attended, want to learn more about it, getting ready for next year, and what some of the opportunities that a viewer could be involved preparing for next year's event. I assume you probably haven't set the date yet for next year's event, but have begun thinking about it already. Break down that evening.
The date has not been set. We will determine that probably in January, and it's all based on the availability of the restaurant where we have it. We could always use people to help out with mailings. We start with a limited list, a guest list that's been put together, and it's usually the same people, and we can add to it. Only 200 people are able to come, so it's limited, and it's first come, first serve. The committee goes around to different organizations, asks for donations, and we also ask for sponsorships. We have businesses in the community and in actually Horry County and Georgetown County that support us at various levels. We ask for a $250, $500, $1,000, or $2,500 sponsorship level.
Right.
That does not get them anything except advertisement, and it exposes us. Some of the businesses were unable to provide their employees with insurances, and in turn, when we've come to them, they've realized that, and they actually send their employees to us for some health care.
Great.
So it kind of has benefited us both. But going into the sponsorship level, that's how we get our sponsors. It starts out with a dinner, and then there's a silent auction going on at the same time. And then after the silent auction closes, we have a live auction. And it's usually over from 6 to 9. It's over by 9.
Great. And some of the auction items, do you remember some of the items from this past April, some of the silent as well as live auction items? Because you highlight 200 folks max, $150. I mean, that alone would be just $30,000. Surely some of the sponsorship opportunities would bump it up. Let's say you got it to $40,000 or $45,000. You raise another $50,000+ from the auctions. Right.
And you know, the thing about it is the people that are coming to the fundraising, a lot of them are coming each year, and they know that they're coming to support a cause, and so they're ready to do that. We're fortunate. We only have 12 live auction items, and we try to make them nice auction items. We had a Bahama Beach house, we had a Pawleys Creek house for a week, and we've had different pieces of jewelry that were made by local jewelers. Football tickets to the Panthers, weekends in Charlotte, things like that. We try to make them nice, attractive packages.
So you all raised some big bucks from the auction.
Yeah, we did. That's our main fundraiser.
Right. This was your fifth. This was your 5th year. As you reflect back on the previous years, you know, and of course you got involved at Smith Medical Clinic. What year, Susan?
In 2000.
Okay, so I guess the first year they kicked off that event, that same year, and of course doing much of the grant writing. As you look back on the years prior, things that you've learned from prior years, as well as, I assume the auction must have been growing pretty substantially.
Absolutely. I think the first year we did the fundraiser, we raised $68,000. So each year it's gradually gone up, and what we've done is our committee has tapped more and more resources. When you have a limited committee, we have a tendency to start out going to the businesses that we know, that connection. And now we've branched out further.
Oh, yeah, sure.
And even from the exposure of being in the paper, we have had people call us and say, well, how can I get involved?
Great, good. And again, that phone number, 843-237-2672. Are you familiar with other free medical clinics in the PD? And is this indicative of other states as well? Would our viewers in Lumberton and Laurinburg have any familiarity with free medical clinics?
Absolutely. North Carolina has a North Carolina Free Clinic Association also. They have a very strong support within their state, and I'm not even sure how many are in North Carolina, but there's a large number of free clinics in the state of North Carolina.
How about our viewers in the PD in Darlington County or Marion or Dillon or Marlborough counties? Are you familiar with any of the other? You talked about the 25 statewide, other than you and the Friendship in Horry. Are you familiar with any of the others in the PD that our viewers may be familiar with?
There is the Mercy Medical Clinic in Florence, and then there's the Darlington Free Medical Clinic in Darlington.
Great.
So they are available.
You know, as you look back over the last 5 years in your involvement with the Smith Medical Clinic, Susan, what's the most exciting aspect for you as you reflect on your 5 years there?
I think as a nurse practitioner, it's exciting to see someone with a chronic disease who has come in with it out of control. what I find out is that majority of the people don't understand the disease process. Somebody told them they had diabetes, take the pill to go away, and they never really understood what it was. We have a great diabetic program, and it's a one-on-one meeting with our diabetic educator, and we really work with them, help them get their medications by putting them on patient assistance programs or putting them on a generic medication that works. And to see their life change, to see the weight go down, the blood sugar get under control, is very exciting. And just to see the patient be in charge of their health care.
I bet, Susan. I bet. If you weren't director of the Smith Medical Clinic, what do you think you'd be doing?
Probably working in the hospital as a nurse.
Yeah. That's great. Thanks so much for being with us this morning.
Well, thank you for having me.
Absolutely. Stay tuned to more Carolina People with Susan Surratt coming up next. Phone number simple, 843-237-2672, 237-2672. To learn about the Smith Medical Clinic, give them a call. If they're not around there, hopefully they'll give you a ring back. But the opportunity to learn, take the time. There's also great volunteer opportunities. The uninsured population of the state is growing. It's growing not only in South Carolina, but in North Carolina, throughout the country. It's not a responsibility of hospitals necessarily. Free medical clinics need to be supported. They need to be supported by the community. Take the time to learn more. Give them a call.